on top are the households with young children. And we know that young children are specifically at risk for food insecurity, and those households with young children experience the greatest percentage of increases in food insecurity over time. So you can see, like, basically for the last 2 decades, food insecurity rates have been between 15 to 20%. And then that went up to between 35 to 40% with the pandemic there. You can see that April 2020 mark. And that's, to be expected given the shelter in place closures and increasing rates of unemployment. So we know that child nutrition programs are extremely important in addressing food insecurity. Here in the US, about 28 million students participate in school lunch programs on a daily basis. And we know that children who actually participate in those programs experience healthier diets. They eat more fruits, more vegetables, they drink more milk. They have better academic performance and classroom behavior, reduced food insecurity, as well as decreased rates of obesity, which are linked to a number of comorbid conditions later in life, such as diabetes and other comorbidities. What I'd like to show you here in this slide is kind of how this partnership developed, and I'm going to have Genoveva and also Cecilia talk about this more in a moment. But with the pandemic, we know that participation in these school meal programs really has dropped significantly. And this slide actually comes from the California Department of Education Nutrition Services Division. They've been collecting participation data for reimbursement of the meal programs. And here in this slide, you can see the percentage of free and reduced price meal eligible students who have been participating in the lunch program in these San Joaquin Valley study districts over time. What I'd like to point out is in April 2019, which is before the pandemic started, you can see the rates of participation was between 70 to 100%, but then that dropped significantly in summer months, which is pretty usual. And then in September 2019, before the pandemic, you can see it goes right back up. But then with the COVID-19 school closures, you can see that the participation rates have dropped off significantly. And I'd like to point out that top line, which is a little higher than all the others. That's one of the districts we've been working with. And the reason it's a little bit higher is because they actually delivered meals. I think we'll have more information about what tactics have worked, but this is really what got our group working, is just trying to understand, what was going to happen to these kids when the schools closed, how they were going to get the food and how their families were going to get access to the food. So I'm going to have Genoveva and Cecilia talk a little bit more about the partnership and how it developed.
Great. I'm happy to jump in. I don't think we decided who was going to go first, but my name is Genoveva Islas, and I'm the Executive Director of Cultiva la Salud. And I just want to start off by saying that the partnership with Dr. Patel has been fantastic, and we're really lucky to work with her. If any of you get the opportunity, you'll understand what I mean. So in the Central Valley, I think what is important to realize is that we are the fruit and vegetable bowl of the world. The Central Valley produces agricultural in all aspects at a scale that is, has rarely been seen in the history of the world, probably. And it is ironic that the same parents who are picking the fruits and vegetables that feed our state and our nation are the same families whose children and themselves suffer from a great deal of food insecurity. Majority of our students, I happen to also be a school board member for Fresno Unified. The majority of our students are Latino. A very large proportion of those families are farm working families. And we see both the hunger in food insecurity that they experience, as well, unfortunately, as malnutrition in the amount of obesity that we're also seeing. So we became very worried with the pandemic as schools were shuttering that there would be a disruption in this staple of food that they often were receiving through school meals. And we were lucky that we were connected to friends such as Ken Hecht at the Nutrition Policy Institute, who really what I would say, connected us with the legal expertise, understanding the waivers that allowed us to position ourselves as advocates on behalf of families to really apply pressure to the school districts about remaining open. And I, of course, as a school board member, did that from the inside as well as outside. But I think that it's a testament about the power of community and the power of connecting research and policy to helping better serve our communities.
And I'll just, Cecilia Castro with the Dolores Huerta Foundation. And I will just add that at the time and our mission, first off, that our mission has always been to educate and empower community members, young students, and parents to be their own advocates and being those that improve their own schools and communities. And so this partnership was just instrumental in DHF and Cultiva being able to fulfill our mission during such a challenging time. So being able to take researchers and all this really great knowledge, tools, and informations to really equip community with the tools and the skills that they need to be their own advocates. So I'll just add that because that was for us, understanding that we could continue our mission by partnering strategically with folks that understood and have that knowledge in order for us to bring that to our community members and have them create community-driven, community-centered solutions that are also sustainable, right? Because it's all about building leadership amongst our communities and creating power within the communities with the work that we've been able to do here with all of our partners.
Thank you so much, Cecilia and Genoveva and Anisha. Let's see, going back to Anisha.
Yes.
Okay, good.
So thank you so much for those comments, because I think it does really help to hear the perspective of how this all came together. So quickly, I'm not going to get into results from these studies, but I just want to highlight a few community-based participatory research studies that we've been conducting. The first here, actually, I think Ashley Joel's on the line as well. Wave, great. So Ashley is a medical student here at Stanford, and she was with us this summer as a med scholar. Actually, Dr. Bruce, who you saw was a recipient of a prestigious award today, she connected us with Ashley because Dr. Bruce had been helping us to understand what had been going on to address food insecurity here in the Bay Area. And so at that point, we were wanting to conduct a needs assessment to get a sense of what was going on, what were some of the strengths and some of the challenges the school districts were facing in providing food during the pandemic period. And so we worked with our community collaborators, as well as many other students, to conduct school district interviews with superintendents and food service directors, as well as focus groups with parents. And Ashley really led the charge on this research. So you can see here the districts that we included were all located in the San Joaquin Valley area. The majority of them were town and rural, but we did have one large city district as well. The majority, as both Genoveva and Cecilia mentioned, are primarily low income, serving large Latino populations. And then here you can also see all the stakeholders we interviewed. And Gabriela Escobar presented these findings earlier from 2 to 3 as a poster session, so you can go visit that if you want more information. But generally what we found were there were some barriers that parents were facing to access the meals, including transportation and logistical information in terms of getting the information about where the meals were being distributed and how in Spanish, and then also the timing of when the meals were provided. And most concerning, they really were worried about the appeal of the meals, the nutritional quality of the meals, the cultural relativity of the meals, and variety. And so now that has led us to a new project that we're working on. And for this project also, we have 2 other Stanford students and residents that are leading this research. Tatum Solberg is a pediatric resident here. And then Emma Higuchi is actually a master's student in sustainability and practice. And what they've done is worked with families on a photo voice project. Parents have taken photographs of meals that they're receiving in these same 6 districts for a week. They've conducted focus groups with these parents to understand, why they took these particular photos. That information is being analyzed and actually being used actively for advocacy efforts related to child nutrition reauthorization, a new bill in California to get universal free meals. we can talk more about that in the Q&A answer period, but this is just a few highlights of the great work that I think we're doing collaboratively. And so just briefly as an acknowledgement, I wanted to acknowledge all the others who have been involved in this work, Lauren Blacker, Valeria Ordonez, and Dr. Bruce here at Stanford. Brandon Cortez is actually a high school student who's working with us through a work study program, and then I've already mentioned the others. And then we have received some generous funding from other sources to help supplement the funding that we're receiving through the Med Scholars Program, and then of course all the individuals who've contributed time to talk to us about their perspectives. So I think I will end there, and then we can take questions.
Wonderful, thank you so much, Anisha. I was remembering that today is Cesar Chavez's birthday. I think he would have been in his 90s, and so it seems particularly fitting to have your presentation and your partners with us today. So we'll do questions for everybody after the next group of presentations. So as we transition from you sharing your screen, Anisha, I think to Dan, I'll introduce the next set of speakers. So our next project is really exciting. They'll be focusing on a COVID-19 testing project that happened right here in our own backyard in Santa Clara County. So we have 4 speakers, and they're going to do rapid lightning style talk. So we're going to start with Ana Lilia Garcia, and she's the Director of Racial and Health Equity at the Public Health Department in Santa Clara County. We'll then pass it off to Jacqueline Franco, who's part of the META collective of community health workers, and Dr. Daniel Ho, who's a professor in our School of Law here at Stanford, and also the director of the Regulation, Evaluation, and Governance Lab. And finally, we have Derek Yang, who is the director of community engagement for the Future Bay initiatives. I will pass it off to you, Dr. Garcia, first.
Hi, good afternoon. Thank you so much for the invitation to share virtual space with all of you today. I'm really excited to be sharing with you our story, our Santa Clara County story related to our COVID response. I am the Racial and Health Equity Senior Manager for the Public Health Department. And since March, I have been at the forefront of this pandemic, centering our efforts and strategies in partnership with organizations like META, which is going to be highlighted today. Next slide. Early on in the pandemic, we were keenly aware of the deeply rooted inequities that exist throughout Santa Clara County. Our Latinx population for Santa Clara County is about 26%, yet the evidence early on was pointing to the disproportionate impact of COVID on communities of color, specifically our Latinx community. We have a large population of Latinos that live in East San Jose, and this was deeply concerning to us early on. But I have to say that going into the pandemic, we have established deeply rooted relationships and partnerships. So we quickly organized and mobilized and called on our partners to better understand the impact that COVID was having in community. And early on, we heard about the fear, the mistrust, the misinformation, the confusion and the concern related to COVID, and also the impact of shelter in place, the order that took effect in March, as many of our essential workers living in East San Jose and Gilroy's and other pockets of the county did not have the luxury to stay at home and were unfortunately at higher risk for COVID. Given all of the information that we gathered early on, it informed the development of our community-centered strategies to address fear, mistrust across the COVID continuum. As we thought about our communication strategy, as we thought about our testing strategy, there was a lot of confusion. Where can I get a test? How do I get a test? And what will I be asked when I get to a site? A lot of fear, rightfully so. A lot of concern about what is contact tracing, case investigation, language that our community started to hear in the news. And there was just inherently a lot of concern and fear related to that. And also, what then happens if I am positive? What is the incentive of me getting a test when downstream, I won't know what to do. I won't have the resources to support my family. I don't have the luxury to isolate and quarantine at home. So given all of that we were hearing and seeing in community, We knew that it was not enough to bring testing into neighborhoods, that it was not enough to establish an isolation and quarantine program to connect families to resources, to much needed resources, but we needed to take it a step further. And that is where we conceptualize this idea in partnership with our promotoras. Jackie Franco is a socia from Meta, Mujeres Empresarias Tomando Acción. And they came to us and they said, we want to work with you. And, we are invested in our community. We care for our community. And, we want to better understand how we can meet this need, this challenge. So the partnership that we've established with Dan and his team has been really instrumental and tremendous in really centering community, centering the needs and the concerns of community, and co-designing, co-developing a strategy that really allows our promotoras to build their own capacity, to have an economic opportunity, to work together and to leverage their expertise and what they know best and who they know best in community. We established our door-to-door testing strategy. And, since December, we have been really working closely with a team of 8 promotoras who have deep roots and deep history in East San Jose to bring testing to neighborhoods, to knock on doors and to not only offer testing, but to really be that bridge in community, because who knows better to understand those needs. We as county, we as government recognize that, that the messenger matters and that we are not a trusted face in community. But really bridging that divide, bridging that barrier, but in our partnership work has really been instrumental in advancing efforts in East San Jose to not only bring testing to community, but to bring a wide range of other resources. I will pause there and I will hand it over to Dan.
Thanks so much, Ana Lilia. Dean Lloyd Minor started this symposium by talking about the profound social disparities that Ana Lilia described. And I think we've all seen across scientific communities the rallying of different disciplines to form completely novel partnerships. And so here we had 2 groups at Stanford, the Future Bay Initiative and the Reg Lab that I direct, that are based out of the School of Earth, the School of Law, and Humanities and Sciences work on this particular initiative. And you might wonder, how on earth did a group like this end up working together? And really where we came in was to try to figure out how we best empower this extraordinary team that was based in the community to really do their work in the most effective way. And the way that worked is we were really leveraging the kind of public health surveillance data that the county had at its disposal. And we developed a kind of strategy for how to really maximize impact in East San Jose. And what that meant is we took East San Jose, part of the county that has been hit hardest by COVID, broke it up into walkable segment based on census and other sort of address enumeration data. And then we borrowed really from some of the various literatures that really informed 3 kinds of strategies. And we actually tested which strategies seemed to work the best. The first was actually suggested by a number of our infectious disease colleagues, which was simply to go where the cases are. So as cases get diagnosed, go to where index cases exist in a household and test the rest of the members within that household. The second was really through sort of a series of conversations with Jackie and her colleagues, who really felt that we have a lot of local knowledge to bring to bear on this. So rather than fixing the particular households, we may have local knowledge of particular events that occurred, and let us have some say in where we provide these testing resources. And then the third one is really borrowed from the machine learning literature, which was to do a form of uncertainty sampling for where we're most uncertain as to the upper bound of the positivity rate, which is an indicator of where testing resources may be seriously lacking. And I'll highlight the results really briefly, which is number one, all of the kind of sort of focus group work that Ana Lilia was talking about, when you compare the nearest testing site, the formal testing site within East San Jose, reached at most 50% of Latinx individuals. Door-to-door testing reached 88%. Latinx individuals, causing a really significant increase in the number of Latinx individuals who were tested. Same thing for individuals aged 65 and older. And then in terms of the effectiveness of the testing strategies, interestingly enough, the infectious disease received wisdom was completely wrong. We had a positivity rate of 2.2% when you target it based on index cases. And the intuition there might be that if there's already an index case in the household, you're just much less likely to engage anyone who's knocking on your door, who you may not know. Local knowledge, on the other hand, outperformed that kind of conventional wisdom from the ID literature, and uncertainty sampling did by far the most to really reach parts of the community where testing resources were needed the most, having an near 11% positivity rate. This was a slice of a wide range of work involving a huge number of individuals that were part of this team. And Derek is here joining us as well, but I really want to turn the floor over to Jackie, because she was actually the person doing this work, with the team of promotoras. And so I'll give the floor to her to give a little bit of a sense of what that experience has been like working together on this project.
Thank you, Dan. Yeah, I think like everything that Ana Lilia and Dan have said so far has been pretty much on point. I think this model of having promotoras from this community that people recognize, that people know, doing the work of, going into the communities, but also like, I think because of our relationships that we already have, making sure that we're reaching that hard hit community that wasn't, getting access to vaccine testing appointments. It was super important, super needed. And I think it provided us an opportunity to really partner in a different way with the county, with Stanford, where it wasn't just, them giving us a kind of drive through of what's going to happen, but allowing us the space to give our input and our knowledge as leaders from this community, and as people who have been primarily impacted by COVID. All the promotoras that are doing this work live in this neighborhood, live in this community, and so we've been impacted by firsthand. And so, we got a really good response. Even the first week we went out, people were recognizing us. Oh yeah, I saw on the news that promotoras were people were gonna do it, but I didn't think it was gonna be like, you guys are neighbors doing this kind of work. So we got overall really good responses. People were really welcoming, really open. They asked us a lot of questions, and even if we didn't have the answers, we made sure to keep that relationship to give them accurate information. And so I think I'm really happy to be doing this work. I think it's much needed, and I think it could serve as a model for other types of work in the county, and other counties that aren't doing this type of work, to really try to be inclusive of having community leaders lead these efforts. And I want to say, I think also just highlighting what Ana Lilia said, that this also provided our families, like I said, we're promotoras who have been impacted by this pandemic, some financial stability to also get paid to do this amazing work. I don't know if I can leave it there, and then if there's any specific questions.
Yeah, I think we have time for Q&A, right, Lisa?
Great, wonderful. Well, I want to thank our presenters, especially our community members who have come to share this space with us today, and our partners. I hope that you will start to put your questions in the chat. We've had a lot of accolades for your presentations. People are really excited. I just have one observation that struck me as we were talking about the door-to-door testing. So Anisha mentioned the success of doorstep deliveries of food for families. I think it was in Santa Clara County in San Jose, in one of the districts. And we see here the success of door-to-door testing, if there isn't some lessons learned that are common across both the COVID-19 and food insecurity work that's being presented here, that this very grassroots door-to-door effort seems to be something that we need to pursue in the future for even other topics. So let's see, I think we really want to talk about the partnership. It's so exciting to have both the academic and community partners here. And I know we have a lot of students, community partners, and other researchers here in the audience. And I'm wondering if you, as the panelists, can talk about some recommendations for forming partnerships, sustaining partnerships, and kind of making it work to make the impact that you want. And I'd love to hear from both the academic and the community side. So you can raise your hand, shout out, or just go ahead. You can raise your virtual hand or your actual hand. I can see you.
I guess maybe I can start us off. So Cecilia again with DHF. I guess one of the things that I was thinking about was the way that we intentionally partner with folks that look at everything through an equity-based lens. And so that's really important for us because in the past, we've experienced challenges with researchers that may not understand the barriers that our communities face and therefore have different kind of expectations and outcomes to projects, right? So I think what was really great about our partnership with Stanford is that they understood, you know, that we were experiencing a lot of barriers at the time, that we have always experienced these barriers, but even more so during the pandemic. So things like being able to translate all the material in a way that is understandable for our community, understanding that because of the digital divide, our community members aren't going to be able to meet virtually in the same way that we're meeting here today, that, we'd have to do phone conferences, conference calls, that, the material would have to be printed out. So just really understanding the community-based organizations and partners and communities and being able to really equip with the tools that the community partners really need, taking all those into consideration. And I would say that goes vice versa, right? Us being able to understand also, the importance of the methodology and the research that our partners are doing, and being able to also work with our community and basically, talking to them about the way that the process works, right? So that they also understand, how these tools are created, so then how we're going to be able to use them for community advocacy.
Wonderful, Cecilia. I think one of the things you really highlighted was the importance of shared values. So finding a researcher who shares values with your organization and with the way that you want to do work. And then also being open to understanding the value of research. So that's a really good message for both researchers, I think, and community partners. Who else of the panelists would like to add?
I was trying to find the hand.
Go ahead.
I'd like to add that, I echo what Cecilia said. It rings very true for me. One of the struggles that we've had here in the San Joaquin Valley is that we are well known as an area of deep health inequities, and there are a lot of researchers who do approach us. And oftentimes it does feel disingenuous because there isn't a reciprocal benefit, right, to the community that they're hoping to engage. And I think the one thing that I will say is that this is not the first project that Anisha has worked on in the San Joaquin Valley, that she has definitely invested in building relationships with organizations on the ground in order to, share her value, right? Like share her genuine interest in wanting to improve what she sees as the injustice that's happening here as well. And I would say the same for Ken and Christina at the Nutrition Policy Institute, who are also, good partners with us. So that the intentionality of forming relationships and doing the good work, right? And coming back and not just parachuting in and going away, like that is really important to us on the ground, that we have trusted partners who are genuinely interested in advancing good in our communities. And so I would say that that's really important to me.
Genoveva, thank you so much for saying that. I think it echoes a lot of what we heard in the keynote earlier, right? So the idea of authentic partnership and a focus on the relationship aspect of it, it really has to be there for the work to flourish. Thank
I
you
just
so
want
much.
to add
Please.
that I echo everything that's already been shared. And for me personally, it's taken years to build a relationship with Jackie. It didn't happen during this pandemic. And I know we find ourselves in a crisis and we're responding. There has to be a deeper commitment to these relationships. And we're very protective of the relationships because it does take time to establish that trust. And I tell my colleagues at public health and at the county, after this pandemic is over, I want to have those relationships intact and stronger. I don't want to lose relationships. And working with Dan's team, which has been really incredible, because him and Derek, have brought in our team from the very beginning. It hasn't been a reactive, but it's rather been a proactive engagement and partnership in a co-design model, really listening and leaning into the expertise of the promotoras, leaning into the expertise and the local knowledge that Jackie and Olivia have, and inviting them into the space has been really, really critical, and honoring and respecting them as equal partners in this has been really instrumental.
Thank you, Ana Lilia. I think the importance of the longevity of relationships is one of the unique contributions you just made. And, relationships during COVID are hard to build without that existing partnership that happened before. And it's really wonderful to hear how you can leverage that to strengthen the relationship during a crisis. Dan, I see your virtual Zoom hand up, please.
Yes, I did find the virtual hand. Yeah, I just wanted to kind of build on what was just expressed, because and connected to some of the earlier keynotes that we heard, because I think there are some academics that can be seen to kind of go in and do what I would call extractive research, which is go in, grab the data set, publish and leave and move on. And I think that very much has not been the model for the Future Bay initiative that Derek leads, or the Reg Lab that I lead. And we've had the luxury, in a sense, of not having been organized in a very conventional lab-like way of, we have our one methodology and we've got that hammer and we want to find the nail and kind of nail it in. It's been much more this kind of process of co-discovery. And I would say that that's actually probably also something where we as a university can do better in terms of how we organize ourselves. We organize labs like, you're the reinforcement learning lab, or you're the lab that really does multiple testing and adjustments for multiple testing. And that's just like not the way we orient ourselves towards actually trying to solve real problems that the pandemic has so exposed. And so I think that's been very much our kind of ethos, and it's been just absolutely wonderful to work with Ana Lilia, Derek, and Jackie, and everyone else on this endeavor.
It's so cool to see you guys upending the status quo structure and doing it in a different way. Let's see, I see Anisha on my screen. I wonder if that's because you're raising your hand and want to share as well. Or am I putting you on the spot?
I was hoping Christina and Ken Hecht are on the line, and they weren't able to join this actual presentation formally, but I was wondering if they had any thoughts, because they're kind of leading the policy front in terms of getting the data to policymakers. And Ken actually, and also Beva, has had relationships for many years. And so I think that was, a key strength of this, was they reached out to Ken with concerns about the schools closing and what's going to happen to the kids in the area. And that's what just started all this kind of work moving forward. But I don't know, Ken and Christina, not to put you on the spot there, but.
Hi, Anisha. Thanks for giving us a chance to pipe up. Well, I want to really reiterate the words that folks have said about not helicoptering in, not parachuting in, whatever. Another way to think about it is this concept of accompaniment. We do some work down on Navajo Nation, and the way it tends to be framed there is this concept of accompaniment, so that we're really working together through the whole process, not just coming in and collecting the data, just coming in and identifying the problem, but staying through until the problem is resolved. In terms of policy, it's been really exciting in our Central Valley project to see how the learnings that we've gained are already useful as we are, working hard on legislative action in DC with child nutrition reauthorization. We can take some of the lessons learned during this period to try to move them forward, not only as we complete the pandemic period, but also to inform policy change farther into the future.
Thank you. And Derek, you haven't had a chance to speak yet. I wonder if you want to say a little bit about the partnership aspect, since I know you've had such an important role in that. Is Derek
Oh,
still
there's
with
so
us?
much great content
Okay.
that's been shared. I'll just note that the one thing unique about the Future Bay Initiative is that we are in fact just set up as a research, education, and practice partnership. So there can be entire course-based teams and endeavors we take on that actually don't have to involve research at all. It can just be direct service and building those relationships. And I think it helps to have that freedom to have those long-term engagements that don't have necessarily a research timeline or research end goal, and can also build off the energy of students who are really passionate about doing this work. And then we can spin off into research outcomes and research questions where they arise. But otherwise, very often we're just solving the same problems that folks are solving on a day-to-day, week-to-week basis, and love doing that with our partners.
I think that's so key. Oftentimes when Stanford and our partners in the community are working together, research isn't always the first person to walk through the door, but rather comes after some service and education projects where we can actually give back in a meaningful way before starting the discussion. I want to give any of our panelists a chance to make another comment. I think we're going to get abruptly kicked out of the breakout room at 5:10, which is always a little frightening. But if anybody has a last thought, I would love to give you the chance. Oh, we have a 5-minute warning. Excellent. Time change. Oh, good. One of the other breakout rooms must be going a little bit longer. Well, good. I had another question. I know that we've highlighted some of the most wonderful aspects of partnership and the impacts that they can have towards health equity. I wonder if you might talk about some of the challenges. Again, some of the panelists, some of the audience members are considering engaging in community-based research, perhaps for the first time or interested in doing it. What can you tell them about the challenges inherent in this, this approach?
I can say that I think one of the difficulties for all of us is finding that flexible funding that allows us sort of to come together for sustained periods, right? Like even within our partnership, we've had a few different types of funders that have allowed us to piecemeal sort of projects together. And luckily, you know, we've been able to build upon it so that the research, you know, that we've done on one end helps inform and helps us think about ideas for more inquiry as we move forward. But certainly it would be wonderful if we had a multi-year sort of long-term funding that would allow all of us to collectively work together and to make sort of investments in community, as well as sort of building leadership within to carry on this work beyond us.
Absolutely. Funding is certainly a challenge, especially for the partnership development portion of the work. Dan.
Yeah, I would absolutely echo your point about funding. You know, we often have like a pre-specified project, and so much of this partnership-oriented work takes you in places that you cannot anticipate in like a linear fashion in a three-year grant proposal. And that, I guess, was going to be my comment. Anna Lily and I were just on the phone the other day, just talking about like, it's just every day there's something changing, and there's like constant problem solving that has to happen. And I feel like that was, in a sense, compounded by the fact that this was COVID response. So we're trying to think about things like, we have people who are non-county employees. Can we bring them on to share PHI? Because some of this information is going to be considered PHI. How quickly could we get them onboarded onto the county system so that they can have devices to do signups on like an iPad? Can we, and you know, and all of that kind of problem solving is like the very real day-to-day kind of work in terms of making something like this come together. But I think, Jackie, I see your hand up as well.
The community-based work can be particularly messy, right? The real world is more messy than a lab. Jackie, I see your hand up, please.
Yeah, I just wanted to share, I guess, like my perspective as a community member. I think something, even not in just like these spaces, but whenever you're working with like an institution or government, there's like their own process and layers of like how they, you know, work or get stuff done. And sometimes as community, it's hard because the problem needs to be addressed now, right? Like the impact is happening now. People in our community are dying right now. And so it's hard for, I think, figuring out a way for like, you know, like that to work, I guess, like in a different kind of way and push, you know, like the needs of the communities, or, you know, the need to do this work or the need to, you know, I was just thinking about like even the work that we were doing, right? Like what if this initiative had been pushed and the idea had been brought up since the beginning, right? Like how many lives could we have saved? And so it's always hard, I think, in that way. What if, like, when you think of the could-haves or what happened. And so at least for us, that's something that really it's hard for us to understand because we're not used to that. And then as well, I think as whenever you're working with community, something that we were really concerned about was like, you know, as us as promotoras, we're out there, like, we're the face, right? We talk to the people, we're trying to get them tested, we're trying to give them information. And then when information is changing all the time, and like people are telling us, but you told us it was this way and now it's this way, I think that also frustrates and it makes us sometimes lose fear that we're gonna lose that trust with our community as well. Yeah.
I think that's a really good point to end on. This really is life and death, food on the table kind of problems that are so important to our community and merits our attention. I want to thank each of the panelists really quickly before we get kicked out.